Onto this now, the South African Medical Association, SAMA, has called for tighter lockdown measures to be implemented as a matter of urgency as the country battles a third wave of coronavirus. The association says the move to level 3 will do little to the rising tide of COVID-19 in the country. Now, for more clarity, we're joined by SAMA Chairperson Dr Angelique Coetzee. Dr. Coetzee, thank you so much for your time this afternoon. Now, when I spoke to you about 2 weeks or so ago, you said that the country was in the eye of the storm. Now, we've heard from President Cyril Ramaphosa yesterday, but you're still not happy about these restrictions. Talk to me about your concerns.
Good afternoon, and good afternoon to all the viewers out there. Yes, 2 weeks ago, we said that we are unofficially already in the third wave, and that the numbers will rise. And we were unhappy with the restrictions because we understand that this virus needs a warm body. It doesn't care who you are, where you are, as long as you are in close contact of less than 1.5 meters from an infected person. So with the previous restrictions, we noticed it did not do a lot to get people staying at home. And again, with last night's restrictions that has been announced, we still have the same problem. To have the curfew till 10 o'clock at night, okay, that's fine. It is now, on weekends as well. It's fine, we can live with that. But the problem is we still need people to stay at home. So by bringing in or opening your restaurants and your shops and bars and stuff where you can still go to later tonight, especially your drinking places and places where you can, as I said, restaurants, makes it that you don't need to have to buy alcohol on Fridays and Saturdays. You can just go and drink in a pub or anywhere else, get into the car after you have sat in one of these entities for quite some time, and hopefully you won't make an accident on your way home. And that's not what we want. We want people at home. We want them to take responsibility at the place where they live. And so in that way, we don't think it's going to make a huge difference. We notice that school holidays is going to come up. We notice that Gauteng is very, very high with cases going forward. With the school holidays, I'm quite sure that these viruses will travel with the Gautengers to KwaZulu-Natal or to Western Cape, and we will see subsequently a rise in those numbers. Actually, last night's level 3 lockdown did not really have a great impact of the one of 2 weeks ago. I think it's difficult for the president. I think he wants to have a balancing type of act that he tries to bring into, to keep everyone happy. But unfortunately, the healthcare is again taking strain, and that is the problem.
You're quite right, Dr. Coetzee, because there is that question of, what happens then to the economy of the country if the restrictions that were, enforced by the president were much stricter, as you are now currently proposing. I mean, last week we also spoke to heads of hospitals, some medical practitioners who told some of our reporters that they are struggling. Talk to us about the situation currently at some of the hospitals. What is happening, particularly in Gauteng, because we know that is the problematic province at the moment? It's a
very sad story. So what is currently happening, if you are sick, and we're not talking about COVID-19, and you try to get an ambulance to take you to any of the hospitals, you will have trouble finding a hospital because the moment you phone the casualty divert the ambulance and just tell them to go and look at, give them random names of other casualties that you must go and look for a place to get that patient in. So the ambulance personnel can't get the patient in. You as a general practitioner, if you phone from your surgery trying to get the patient in, the same story. So we literally now have to ask patients that is really sick, actually you don't want them to get into their car, but to get into the car and walk into a casualty to see whether they can lie in a bed somewhere, whether it's in a corridor or wherever, just to get the high flow nasal oxygen. So it's a huge problem. In the private hospitals, you literally have to wait for someone to die to get a bed in ICU. We see that in Pretoria and in Joburg with the private sector hospitals. Then you look at your public sector hospitals. We don't have a lot of information there, but we presume the same is happening there. Because remember, Charlotte Macheke Hospital is closed. It's a big hospital. So all those patients will then now be treated by the other hospitals in the surroundings, the public sector hospitals there. So high flow oxygen is available, the liquid oxygen. So we're not going to run out of oxygen this time. But we are having the same problem that we had in the previous 2 waves. Not enough trained medical doctors and nursing staff to take care of a patient in a bed. So we will have enough beds. But a bed needs a doctor and a nurse around it. And that's the problem. We don't have that.
Dr. Coetzee, we are running out of time, but perhaps one last question from my side. Now, we know that we are dealing with one variant here in South Africa, and we also know that the vaccination process is relatively at a very low pace. Nobody is happy. We're currently vaccinating about 80,000 people per day. President Cyril Ramaphosa seems to think that it could go up to 300,000 at the very least, but we're nowhere near that yet. How are the vaccination process is going at the moment, in your views, and talk to me a little bit about the variants. Are we still battling just that one variant that we saw a couple of months ago?
Yes, for now, it's still the South African variant, or the beta variant, as I call it. We know the Indian variant is here as well. Not sure how predominant that virus is, but we know that our own one is that was responsible for December is still responsible for now. Regarding the vaccine rollout, it's too slow, but it's not going to help and assist us in the 3rd wave, as we are already in the 3rd wave, and it takes too long for people to get immunity. Remember, there is around about 5 million people that needs to be vaccinated above the age of 60. We're around about 1,600, I think, vaccinations. So we're very far off our target, and this is after 1 month. We also have a problem. The faster we go with the vaccines, the quicker we're going to run out of them, because we know that we don't have enough vaccines for the 2nd dose.
Dr. Coetzee, thank you so much again for making the time to speak to us this afternoon. Unfortunately, not very good news on your front, but thank you so much for your time. SAMA Chairperson Dr. Coetzee there for us. Now